My name is Dr. Geeta Sinha. I am in the Department of Anatomy and Neurobiology with Faculty of Medicine. This is the second video of the Pelvis and Perineum series. In this video, I will be talking about male and female perineum. I will also discuss the construction of the UG diaphragm, and also I will be talking about the external genitalia in male and female, and especially the extent of the superficial pouch. On this pelvic model, I'm going to define the boundaries of the perineum. The perineum is a diamond-shaped area of the body which is bounded anteriorly by the pubic symphysis. On lateral aspect, right ischiopubic ramus and left ischiopubic ramus. On the posterior aspect, it is completed by the right and left sacrotuberous ligament, and posteriorly the tip of coccyx. This diamond-shaped area can be subdivided into two triangles by an imaginary line which passes through the two ischial tuberosities. The anterior triangle is called as Urogenital Triangle. This is the area where the opening for the urethra and the vagina is present. The posterior triangle, this area here, is the anal triangle. Anal triangle contains the opening of the anal canal. On this male perineal model, I'm going to show the details about the urogenital triangle and the anal triangles. This is pubic symphysis, ischial tuberosity, tip of the coccyx, anus. I'm going to remove the skin from this diamond-shaped area. Now we are looking at the two triangles, pubic symphysis, ischiopubic ramus, ischial tuberosity, sacrotuberous ligament, tip of the coccyx. Putting this imaginary line, this triangle is the anal triangle. There is the opening of the anal canal. These two space on each side is known as ischiorectal fossae. The ischiorectal fossae contains fat cells, which is shown in this area here, and it contains a special type of liquid fat in these fat cells, which gets space for the extension of the rectum. This triangle has got on the medial boundaries formed by the anal canal, the superior boundary or the roof of this area here is formed by the levator ani muscle or pelvic floor. The lateral boundary is formed by the obturator internis muscle, and the floor is formed by the skin and superficial fascia. In the middle here, we have got the opening of the anal canal. In this area, we see a lot of anorectal abscess, anorectal fissures, and also the hemorrhoids. Because of the fecal contamination and the poor blood supply to this fat, it's difficult to treat by oral antibiotics. So a lot of surgical intervention has to be done, especially in the case of the fistula, fissure, or other infection in this region, which happens quite often because of the fecal contamination. If we look at the anterior triangle, this triangle gives attachment to external genitalia. To give attachment to external genitalia, it has got a special diaphragm. Now I'm holding between my finger and the probe this triangular piece here, which represent the urogenital diaphragm. And this diaphragm is made by two fascial layers, and in between those fascial layers there are muscles and vessels. These two fascial layers attach on each side to the ischopubic rami. Superficial to this diaphragm, we can see the attachment of the external genitalia here. In case of male, we see the bulb of penis. There is the crura of the penis, and also the superficial muscles which are covering these erectile elements. We also see the nerves and vessels which are going to supply the external genitalia. Now this membrane or this urogenital diaphragm sort of divides this triangle into two spaces. The first space is between the skin. So if I put the skin back, so if we remove the skin, we are into this space. This is called a superficial perineal space. The superficial perineal space contains the external genitalia. The deep space is a potential space which lies between the two layers of the fascia. Pubic symphysis, ischopubic rami, ischial tuberosities, sacrotuberous ligament, and tip of the coccyx. So this diamond-shaped area is the area of the perineum. The superior boundary is formed by the levator ani muscle. So here is this cup represents the pelvic floor, levator ani and ischococcygeus muscle. So this area below the pelvic floor to the skin is the area of the perineum. This triangle here is the urogenital triangle, and this triangle has got another diaphragm. This triangular diaphragm gives attachment to the external genitalia. So if I put the pelvis into normal, rotated to 80 degrees, which is the normal position of the pelvis, this is the position of the UG diaphragm. It faces inferiorly. Now UG diaphragm is formed by two membranes. This is the superior fascia of the UG diaphragm, because if we put the pelvis into normal position, this membrane becomes superior. The other membrane, which is shown here with the yellow piece here, this is the inferior membrane of UG diaphragm. And in between the two fascia, there are muscles and the vessels lying in between. So it's almost like a sandwich with two breads and the meat in the middle. And that's what all these muscles which are lying in there, they fill up the space which is called as deep perineal space. It's a potential space. From this membrane, which is also known as perineal membrane or inferior fascia of the UG diaphragm, is a very tough membrane extend between the two ischiopubic ramus, and that gives attachment to all the external genitalia. From the membrane all the way to skin, this space here in this triangle is known as superficial pouch. So superficial pouch, what does it contain? It contains the external genitalia, the muscles over those attachment of these genitalia, and the nerves and vessels which are supplying this area. What does the deep space contains? The deep space is between the perineal membrane or inferior fascia of the UG diaphragm and the superior fascia of the UG diaphragm, and it contains two muscles, which is in the circle which is showing a muscle which goes around the urethra, sphincter urethrae muscle, which has got a sphincteric action around the urethra, and the deep transverse perineal muscle. On this female perineum model, I'm going to talk about the external genitalia and also the contents of the superficial perineal pouch. Pubic symphysis, ischiopubic ramus on each side, ischial tuberosities, sacrotuberous ligament, and tip of the coccyx. So this diamond-shaped area is the perineum. By imaginary line, this is the anterior triangle, contains the opening of urethra, vagina, and in the anal triangle on the posterior aspect, the anus. The urogenital triangle differs in female and in male. So what we are looking here into the urogenital triangle, this is the mons pubis. There is the left labia majora, labia minora. I'm going to remove now the skin flap as well as this fold of skin, the labia minora, which the labia minora guards the vestibule of the vagina. I'm going to remove that, and we are into superficial perineal pouch. This triangular area that contains the bulb of the vestibule, which is erectile tissue, which lies on each side of the vaginal opening. This is the left crura of the clitoris. The right crura of the clitoris comes and attaches to ischiopubic ramus, and they join together to form the body of the clitoris. And at the tip of this body, we see the glands of the clitoris. The bulbospongiosus muscle, which is shown here on each side of the opening of the vagina, covers the bulb of the vagina. Deep to the lower end of the bulb of the vagina, I'm pointing to the greater vestibular gland on each side. The greater vestibular gland is also known as Bartholin gland. Bartholin gland, by a duct, secretes its secretion into the lower part of the vagina and lubricates it before the coitus or before the sex. The infection of the Bartholin gland is very common, and that infection creates a cyst which is called as Bartholin cyst. We also see in the superficial pouch the perineal nerve and perineal blood vessels, which supply the content of the superficial pouch. The bulbospongiosus muscle, superficial transverse perineal muscle, and ischiocavernosus muscle, which covers the crura of the clitoris. A very important structure which lies at the just tip of my probe, and that is known as perineal body. Perineal body is very important for the attachment of these perineal muscle, and it's a main anchoring point. A laceration of the vagina, which can involve the perineal body, can cause the weakness in the floor of the perineum, and that can cause prolapse of these internal organs. Now let's look at the UG diaphragm. So UG diaphragm is formed by the two fascial layer. The one which I am pointing is the perineal membrane. It is also known as inferior fascia of the UG diaphragm or urogenital diaphragm. And if I turn it out on the deeper aspect, we are looking at the deep fascia of the UG diaphragm. Between these two layers of this diaphragm, in between, sandwiched in between these two fascia, lies two muscles, and which I cannot show you, but that is deep transverse perineal muscle, which is almost goes in the direction like superficial transverse perineal muscle, and the sphincter urethrae muscle, which goes around the urethra. It also contains the deep perineal nerves and vessels which supply these muscles. On this model, I'm going to show you the content of the superficial pouch in male. The superficial perineal pouch in male contains the root of the penis. The root of the penis is glued onto the UG diaphragm. And here is the UG diaphragm, this triangular membrane extending between the right and left ischiopubic rami. This is perineal membrane. Here I'm pointing to the deep fascia of the UG diaphragm. Glued onto the perineal membrane is the bulb of penis. The bulb continues on, it's made of erectile tissue, and it continues as corpus spongiosum, which forms the body of the penis, and it finishes as the glans of penis. The bulb of the penis is covered by a muscle, and this muscle is known as bulbospongiosus muscle. Bulbospongiosus muscle originates from the perineal membrane. On right and left side, it meets in a median raphe. That's where it's joined together. Some of the lower fibers meet at the perineal body. Other muscle we see in the superficial pouch is the transverse perineal muscle, superficial transverse perineal muscle, which comes from the ischial tuberosity and meets the perineal body or the other side of this transverse perineal muscle. Now I'm pointing to the left crus of the penis, And the right and left crus of the penis is formed by the corpus cavernosum, and that continues as one single element which covers the corpus spongiosum. A muscle which covers the corpus cavernosum is known as ischiocavernosus muscle. Ischiocavernosus muscle originates from ischiopubic ramus, wraps over the crura, and attaches to the perineal membrane. The bulbospongiosus, ischiocavernosus, and transverse perineal, these are the three muscles found in the superficial pouch, and they are supplied by the perineal branch of the pudendal nerve. On this side of the model, there are two muscles which are found in the deep perineal pouch. So basically the perineal membrane has been taken out. We are looking at deep transverse perineal muscle and a sphincter urethrae muscle, which makes a sphincter around the membranous urethra. The gland which I am pointing in the deep perineal pouch, this is the bulbourethral gland or the Kapoor's gland. On this model, I am going to show you some of the contents of the superficial pouch in male. Just this is pubic symphysis. This is the right ischiopubic ramus, the obturator foramen with the obturator membrane. This is the obturator externus muscle. Ischial tuberosities, tip of the coccyx, the sacrotuberous ligament. The sacrotuberous ligament has been taken out. The sacrospinous ligament we can see in there. This is the anal triangle, and space on each side of the anal canal. Here is the ischiorectal fossae, right and left. We can see some of the fibers of external sphincter around the anal opening. The medial boundary is formed by the obturator. The lateral boundary of the ischiorectal fossa on the side is formed by the obturator internus muscle. This is the obturator internus muscle tendon. The roof is formed by the levator ani muscle. This is the levator ani muscle. The floor is formed by the skin, which is gone, and this is all the fat cells has been taken out. In the anterior triangle, we see the free edge. Here is this triangular edge which I'm holding down. This is the part of the UG diaphragm on each side, which is the UG diaphragm extending between the ischiopubic rami. This is the perineal membrane or inferior fascia of the UG diaphragm, and glued on to the fascia is the root of the penis, which is formed by the bulb. On this side, we remove the bulbospongiosus muscle and we can see the bulb of the penis. The bulb continues as the corpus spongiosum. The corpus and the free edge extend and makes the glands. The penile urethra travels through the corpus spongiosum. This structure which I'm holding is the left crura of the penis, which is attached to the ischiopubic ramus, and the muscle which is covering that is the ischiocavernosus muscle. The two crura meet together and form the corpus cavernosum, which joins the corpus spongiosum, form the body of the penis. The muscle which I am holding on over the bulb of the penis is bulbospongiosus muscle. And bulbospongiosus muscle, contraction of this muscle, expels the last drop of the urine and the semen at the ejaculatory phase of the genital reflex. Probably few fibers I'm holding here. These fibers are the fibers of the superficial transverse perineal muscle. The ischiocavernosus, bulbospongiosus, and the superficial transverse perineal muscle is supplied by the perineal branch of the pudendal nerve. The blood vessels, the blood supply of these muscles is the perineal branch of the internal pudendal artery, and the veins which are draining this area are the perineal veins which drain into the internal pudendal vein. The urethra in male has got three distinct parts. It starts at the neck of the bladder, travels through the prostate gland, and this part of the urethra is known as prostatic urethra. The ejaculatory duct from the right and left side brings the semen and the fluid from the seminal vesicle into the prostatic part of urethra. The prostatic urethra, when it travels through the UG diaphragm, which is this diaphragm here, this area here is known as membranous part of urethra. After traveling through the UG diaphragm, urethra comes and travels through the bulb of penis. This part of urethra is penile urethra. It travels through the corpus spongiosum and opens at the external urethral meatus. One of the important clinical aspects of the rupture of the urethra I would like to mention, the injury to the hip bone or perineal injury can cause rupture of the membranous part of urethra, or it can have the rupture on the penile part of the urethra. These are the two areas which are more liable for the injury, especially the bike accidents, and that causes extravasation of the urine. When the urine is not confined in the urethra, it starts passing to the areas around the urethra. It leaks into the scrotal sac, which is around here. It comes down and accumulates around the penis between the superficial fascia and the deep fascia. It can also ascend up to the anterior abdominal wall, but it does not leak into the region of thigh or in the anal triangle in the posterior aspect, because the fascia is attached around the inguinal ligament, around the ischopubic region, and on the inferior area of the UG diaphragm. This closes the urine for going into the anal triangle. It is important to understand the different region of the urethra and the different curves when passing a catheter in male. In male, the urethra is long and it has three distinct portions. The first part of the urethra is when it passes through the prostate gland. This region starts at the neck of the bladder all the way when it reaches to the UG diaphragm. This part of urethra is known as prostatic urethra. The part of the urethra which passes through the UG diaphragm, which is the diaphragm position of the diaphragm here, this area is known as membranous urethra. The membranous urethra then becomes the penile urethra when it passes through the corpus spongiosum, and it comes to the external meatus where it ends. The urethra more or less is a S-shaped in its curve, and many times a well-lubricated catheter can be passed by turning the penis into a J-shaped curve, which is sort of holding it upwards, and that way we relieve the constriction around the area of the membranous urethra, which is a constricted area, and a catheter can have difficulty in passing through that area. By lowering the penis at that point helps the catheter to pass in the prostatic part of the urethra. On this cross section, we are going to see some of the contents of the superficial perineal pouch in female. Most of the muscles are very fine in the UG diaphragm, so it is hard to see in female. Just to get you oriented, this is the pubic symphysis, ischial tuberosity, and I'm holding the UG diaphragm over my probe. This is the part of the perineal membrane which we sort of see. The bulb of vestibule, this is the position of the bulb of vestibule on each side of the vaginal vestibule. And now I'm pointing to crura, the left crura of the clitoris. That's the right crura of the clitoris attached to the ischiopubic ramus. Covering the crura, this is ischiocavernosus muscle. The two crura join together and form the body of the clitoris, and here is the glans of the clitoris. Lower part of the vestibular bulb, this is the position of the greater vestibular gland or the Bartholin's gland. In the posterior aspect, we are looking at the anal triangle. The boundary is here is the imaginary line between the two tuberosity. Tip of the coccyx, sacrotuberous ligament. On this side, the gluteus maximus is covering the sacrotuberous ligament. This is the superior boundary is the pelvic floor, or the part of the levator ani and the coccygeus muscle. We are also seeing some of the inferior rectal branches of the pudendal nerve and inferior rectal artery coming from the internal pudendal artery. These nerves supply the external sphincter of the anus. Some of the perineal branches may be going towards the urogenital triangle.